Hello, and welcome to the Waldenstrom's Macroglobulinemia Patient Perspective video series. I am Sharon Piotrowski, and I will be your host. The information you will hear in this video series is from the perspective of WM patients and/or their caregivers. The goal is to share their unique perspectives, which may help someone else who has been diagnosed with this rare cancer. Please remember the information provided by the participants in this series is reflective of their unique journey. It should not replace the advice you are getting from your own doctor. This week, we'll be hearing from 5 WM patients discussing how they found out they had WM. Thank you to all who are participating for sharing your journeys. Let's get started. Thank you for joining me for the WM Patient Perspective video series. This week's topic, we're going to be talking about how one found out that they had WM. Today, our guest is Kathy, and she's going to share with us her journey to finding out how she had this rare cancer. Kathy, thank you for joining me today.
Oh, you're welcome. I'm looking forward to this.
Great. Well, let's just get right into it. Kathy, when were you diagnosed with WM?
Okay, the day will live in infamy. I will remember it forever. It was on March 3rd, 2019. About 2.5 weeks prior to that, I had had a knee replacement on my left knee. Everything went fine. I was walking without assistance in 2 weeks, and all of a sudden, I get a call from my orthopedic office, and the doctor's like, "Oh, I don't really know what to make out of this." He said, "But you're going to need to see an oncologist." And I was like, "What?" And he goes, "Oh, I put everything on my chart. You can go ahead and look at it." So, of course, as soon as I hung up from him, I looked at it. And so, in the process of about 2.5 weeks, I had the bone marrow biopsy and got the diagnosis.
Kathy, you just went in for a knee replacement. What made the doctor realize that there was something more than just a knee replacement? Did he have to take samples or?
Well, apparently, whenever they take anything out of you, no matter what it is, apparently federal law is that it has to be biopsied. So, yeah, I didn't know that either, but apparently they did a biopsy on my damaged knee, and those little malignant B cells showed up, but it wasn't like a real good sample, and they couldn't really tell. So the report from pathology said strongly suspicious of a malignancy, but obviously a referral, for more testing. So,
Wow, Kathy, that's just so different than everything else I've ever heard about WM. I do have a question. Did you know, or did you think back? Did you have any other symptoms other than knowing that you had to go in for a knee replacement? Looking back on it now.
well, looking back at it now, my first answer would be no, because I was in such pain from my knee hurt so bad. I didn't pay attention to much else. But I think after the dust settled, I remember a few times when I was just incredibly tired, extreme fatigue. But once again, I kind of blew it off to, my knee hurt so bad. I wasn't sleeping. I was in a lot of pain. But outside of that, no, all my pre-op blood tests and everything were normal. So
Wow.
only my
Now,
luck. Only I would go into the hospital for a knee replacement and come out with this weird diagnosis that nobody heard about, that I had never heard about. So,
what did you think when that doctor said that to you and said that you now have to go see another doctor or a specialist? Like, how did you feel? That must have been really
oh,
mind-boggling.
I said a lot of four-letter words, but I was not. It was I think it was just a shock, and I kept thinking, oh, pathology sometimes makes a mistake, and I have a little bit of a medical background from my training, and so I was delving into all the pathology reports and stuff like that, and googling things, which is not good, but I was doing a lot of that, and so I just I think it was just like total shock and thinking there's a mistake, this because I felt so good afterwards. I mean, my knee, I wasn't even taking pain medicine because my knee hurt so bad before the knee replacement that afterwards they kept offering me, stronger pain meds. And I was like, no, I'm fine with just Tylenol. So, yeah, Tylenol and ice. And I think that, yeah, it was weird.
Wow. So I guess now the next step was you went to see a doctor, correct?
Hmm.
And what Again, no really symptoms other than what did your doctor tell you or the oncologist tell you?
Well, I got got a referral to University Hospital Seidman Cancer Center, and the oncologist, when I first met with her, she was reviewing all the stuff, and she's like, "Well, let's not panic yet." So I thought, "Okay, good. That's what I wanted to hear." And she said, "Well, we'll do a bone marrow biopsy." And this was like about 2 weeks after the surgery. I was like, "I just had major surgery." She's like, "Well, it's a piece of cake compared to what you went through." So about 2.5 weeks later, I had the bone marrow biopsy. Once again, kind of thinking, she said, let's not panic. So I'm not going to panic. But yeah, I did have the bone marrow biopsy. And then she also ordered the PET scan.
Oh, she did. And what did they find on your PET scan?
Actually, they found the bone marrow lit up. But that wasn't unusual, according to the radiologist, because I had just had major surgery. And they said that that wasn't unusual, but nothing else would, there were no like weird tumors or anything else. Of course, I was afraid of multiple myeloma and stuff like that. Nothing showed up in my bones or anything like that. Of course, they always pick up little weird things when they do that PET scan, and it's like, okay, whatever. But yeah, it was really the bone marrow biopsy that told them.
Wow, that's just incredible. And I know a lot of people always ask this, not that it's as relatable anymore, but what was your IgM?
At diagnosis, when I first got diagnosed, it was already 2,850.
Okay.
So I was
Okay.
like, okay, I've had this for a little bit.
A couple less questions. Did you tell family and friends that you had this rare cancer?
I think I was so shocked and upset that yes, I did. I think my mother had just died a little bit ago, and then I was taking care of my stepfather, and I have a brother that has a severe disability, and I'm his legal guardian. So
Mm.
I was so freaked out by everything and the diagnosis that yes, I did tell people. I think only because I had to keep repeating it, hearing myself say it, to make myself believe that this actually happened.
And it's such a big word to say also.
Well, I can spell it now too. So,
Well, now 3 years looking back, what advice would you give to someone else that's being diagnosed with WM?
um, first of all, stay off of Google. I made myself a nervous wreck doing that. I have a new oncologist now in Cleveland. It took me a while to find somebody, but she kind of keeps telling me the same thing, even though I'm doing really well now. And the first time that I met with Dr. Castillo, that was the first thing he said was, "You got to stop this." So I was making myself crazy. So I think that might be the first thing I would say. And I think the other thing I would probably tell new people is you just got to go with what they tell you and not think too much about all the what ifs. And I know that's really, really hard to do, but I think over the course of the past 3 years, I've learned that I can't really change anything that happened. You can't blame yourself. I think that was the other thing. I blamed myself. I think that's just something natural. So I think I would tell people stay off of the internet, go to trusted sources, certainly the IWMF. I found it by accident. I was just doing research one night when I couldn't sleep. And I also ordered weird things off of Amazon because I couldn't sleep. And it was like, I don't know why I ordered this. But at any rate, I have a weird sense of humor too. So that also helps. I think you kind of you kind of have to keep your sense of humor about it. And I did tell my closest friends and some of my family only because, like I said, it just helped for me to keep saying it for me to process it.
I totally understand that. Well, Kathy, I want to thank you so much for sharing your unique story with us. I think it will help a lot of people in their future if they are diagnosed with WM. And on behalf of Kathy, the IWMF, and myself, I want to thank you all for watching our video today. WM patients and or their caregivers are encouraged to join us on future topics on this video series. So please email me at wmpatientperspectivevideos@gmail.com. Thank you again for everyone that's watching today. If you'd like to give us some feedback, we'd love to read your comments below the video. And again, thank you, and I will see you on our next video.